My first reaction was, crap, how come no one thought about a meme coin that was going to fund rare disease research? I noticed a tweet from this guy, Siki Chen, who's like, some rando donated 50% of a meme coin to my daughter because he saw my GoFundMe for my daughter's rare cancer. And then a space was opened up and then everyone's just watching this token massively, take off like one of Elon's rockets.
Hi everyone, and welcome to DeSci Pilled. I am your host, Ryan Bethencourt, and today we're talking to the amazing Ethan Perlstein. Ethan is a multi-time entrepreneur, investor in the biotech space. He's going to tell us a lot about his new DeSci company called Curetopia. We're kicking this off here in Research Triangle Park. And where are you, Ethan? I know you jump between SF and New York, so
back in the Bay.
All right, Ethan's back in the Bay. So Ethan, thanks for joining us. This is our first episode, so really excited. I'm delighted to be sponsored by BioProtocol. We're really excited by a lot of the work that Bio is doing to accelerate the decentralized science movement on both Ethereum and Solana. And we have Ethan, who's going to be launching the first Solana BioDAO. But before we jump into the BioDAO, why don't we start a little bit, Ethan? There's kind of a meld between scientists, crypto degens. We've got a lot of people tuning in that are just curious about this whole space. And so why don't you tell us a little bit about yourself, your journey in science, and then we're going to talk a little bit about crypto. I know in the past you said you were originally more of a Bitcoin maxi. You kind of got into the Ethereum world, and now we're getting into the Solana world. Still are.
Intense.
And so we're gonna be talking a lot about that journey too. But why don't we talk more about the science journey first?
Yeah. I got DeSci Pilled. Forget about DeSci Pilled. I got DeSci Pilled as a young kid and wanted to be a scientist. And then I was told, oh yeah, okay, then I guess you do a PhD and then you do a postdoc and then you become a professor and then voila, you're a scientist. So that's about as much as I knew. Yeah, I did my PhD at Harvard and thought that being a professor was just like the be all and end all. But I was on the academic path, and then I got a postdoctoral fellowship at Princeton and was able to run my own lab for 5 years, and that was great. And at the time, I was told that was preparation for a tenure track job in academia. What no one told me was that running my own small group and managing a budget was actually, basically a flight simulator of a startup. So I tried to get an academic job, failed, and yeah, I did not apply to 100 places like I was told, and so I didn't get in to any of the places I applied, and so started to do a pivot. And then that's when I realized, oh yeah, I was actually training to be an entrepreneur as much as I was trained to be a professor. And when I stopped my postdoc, I started a crowdfunding project, and it was to fund a meth lab. That's kind of how we marketed it. And I was watching way too much Breaking Bad at the time. We raised $25K on this site called Rocket Hub. I don't even know if that site exists anymore, but
I don't think it does.
Probably doesn't. But raised $25K, which at the time was like a record for a science project. About a month later, Ubiome, people remember them. They raised like $200K.
The now infamous.
The now very
Ubiome.
infamous. The founders still on the lam, probably have gotten plastic surgery. Maybe they're listening as well. But
even that's a funny story too. So I guess allegedly they committed federal fraud, I guess, on Medicare and Medicaid, and they are apparently allegedly on the run somewhere in Germany. Ubiome was doing fraud, but they were a success story at the time in Silicon Valley. So
they were.
It's fun.
Yeah. As soon as I raised $25K, then these people come out and raise $200K on crowdfunding, and then okay. Anyway, that's a side story. Yeah. But I got my taste for, I guess, being a founder doing that crowdfund, and then realized I didn't really want to focus on meth for my research proposal forever. So I decided to. I didn't really decide, but I kind of got lucky and met a rare disease mom one day in 2013 on Rare Disease Day, and was just blown away by how much science she knew, how entrepreneurial she was, and never signed up for this job, right? Her twin daughters got this horrible genetic disease. They've since unfortunately passed on. But meeting this mom just lit a fire under me, and that's kind of the real beginning of my startup journey, and also the beginning of my rare disease commitment.
Yeah, and then at some point you moved to Silicon Valley, right? Because that's when we met each other. We kind of connected on the postdocalypse, where there were all these PhD students and postdocs that couldn't get professor jobs, and now they were struggling to find a path forward. And entrepreneurship seemed to be that path, right? And so I met you and you were in the process. I think you were working, you're doing some consulting, and then you were about to start what became Pearlstein Labs and then Perlara, right? Which was your rare disease company.
Right. So I moved to the Bay Area in April 2013, and then kind of, spent a year basically preparing to start my first company. It was called Pearlstein Lab. It was set up as the first Biotech Public Benefit Corporation, or PBC. At the time, that was super exotic set of initials. We were a little ahead of our time there, but that was a really cool experience to start a new kind of biotech company and also to commit to rare diseases, which is, basically the anti-portfolio of pharma, right? It's the programs that pharma is running away from. And I just smelled the opportunity, plus met more and more of these exceptional parents and realized maybe there's actually a business that can be built collaborating with these parents.
Yeah, and I thought one of the amazing things was you got into Y Combinator, right? So I think for a lot of startup people, that's like, whoa. And that was the beginning of that Silicon Valley journey. So rare disease focused, the scientist turned entrepreneur, which at the time was fairly rare.
Well, that was still like a news story. Now it's like, it's called tech bio. But like back then, that was like a news story.
Yeah. And so, okay, so you started Perlara, you really learned a lot, right? And so tell us like what the technology was kind of at a top level.
Yeah, so it's still a going concern. It's entering its 11th year now. But it was started out as Pearlstein Lab because I wasn't very smart about marketing and branding. Eventually realized that's not a really acceptable long-term name. So it ended up becoming Perlara. But the company was started as a trad bio platform company, meaning we had some technology. In this case, it was using simple animal models or avatars. Yeast, worms, and flies. We basically rebranded them as avatars, patient avatars, and then started to focus on repurposing because that was the way that we could get results to families fastest, right? Sure, they like the sound of CRISPR and gene therapy and whatever, but the reality is they just wanted something that could stabilize or stop the disease today. And drug repurposing, finding a new use for an old drug, was the fastest path. So because we were gravitating toward the families, they gravitated us toward repurposing. And, we were able to kind of create this DTC biotech model where families and foundations could come to us, pay for research. We do it essentially at cost. Go back probably without a loss, but we try to do it at cost. And then once we got to discovering a molecule, we would then work with those families on trying it out in the clinic, or not really a clinical trial, but really just what we now would call a decentralized parent-led study. Perlara was the first place where we could experiment with this concept of N of one. And Brian Johnson's now like the N of one messiah.
So let's just add some context, Ethan, for people. So N of one is a study with one person, right? Like that's very, very powerful way of like one person, unique biology testing to see. And what, your platform Perlara used a genetic mutation, which was very similar. So you would create a genetic mutation in the yeast. First started off on the yeast platform. So these are little microscopic yeast, kind of how you bake bread and whatever else, but we use them in science a lot. And so you created a genetic mutation that was similar to the person who had the rare disease, that genetic mutation. And if this combination of repurposed drugs, and by the way, over-the-counter molecules too, things that are present in supplements, worked to help extend the lifespan of that yeast, you would move it through to worms and flies. And by the way, shout out to Pump Science, who's doing incredible stuff with longevity and testing on worms and flies too. C. elegans and Drosophila. These are our favorite. We can definitely nerd out on a bunch of stuff like why we use those in science. But you were able to get some really interesting results, right? I think, honestly, you blew me away when you were telling me some simple things, like things that you can go out to like your local drugstore and buy were actually helping these kids who had these rare diseases that really didn't have any other choices, right? Talk to us a little bit about that.
Yeah, we've put all of this out there. If you go to it's gone out through Perlara's Substack traditionally, but obviously we'll start pumping stuff out through Curetopia's channels. But Perlara has a Substack called Curetopia, and this is where we document all these journeys. So I'll tell you one recent example. Everyone probably listening, or many people listening, have heard or even taking NMN, which is the supplement that boosts your NAD levels, right? Everyone who's in this space is probably familiar with that. People talk about this as an energy booster. So we
shout out to all the biohackers, the Brian Johnsons of the world, hacking their own biology and with these great supplements. Mm-hmm.
So, we arrived at NMN because we created a yeast avatar that is sort of sick with the disease that we were studying. And then just through an unbiased screen, we found that NMN and other NAD boosters were rescuing this yeast. And so we were like, fantastic. And then some parents who were funding the study stepped up. And because it's an over-the-counter, they're like, well, we don't really need much more evidence than the yeast, because we could have just randomly taken this molecule without any justification because it's available. But now we actually have a reason. And so now I think the 5th patient's about to start taking it. But I've been looking at videos before and after, and it's pretty remarkable to sort of see. And I already shared some of those videos on our Substack, but I was able to meet a 19-year-old kid in New York last week who's been taking NMN now for 3 months. And his mother was there, and she was saying, she was acting as his cane. He couldn't walk anywhere without her physical support, and now he can walk without it. And now he can walk on his own. 3 months. Incredible. And we captured this result on video, so it's seeing is believing. We quantified it with a validated instrument, a validated clinical questionnaire that's given by a clinician to measure ataxia or movement disorder. And we saw almost a 50% improvement in 3 months, which is kind of crazy. So,
by the way, that's nuts. This is just for everyone to really think about. This is a rare disease where it's degenerative. It ends up like the patient gets worse and worse. And to actually see an improvement in a patient with a rare disease, a person with a rare disease, is very rare. And so to be able to actually figure it out from yeast and bring that into humans with a supplement and see a significant change is honestly transformational. I know a lot of people are like, that's just too good to be true. How is this even possible? Why didn't Big Pharma figure this out, right? Like, I'm sure you've been asked this a million times. Like, what are your thoughts on that?
Yeah, I mean, we also have another example of vitamin C doing something. So, the answer is like, if this thing is available from Amazon for $20, you're not going to get pharma to be pursuing this. And even if you could pursue combinations of things, it's not, pharma's more attracted to like novel compounds and novel IP, and that's what they feel most comfortable with. So they're just not interested in supplements or even supplement stacks. Certainly, obviously, don't really care about rare diseases. Like, I really know that. So it's not that hard to see why this has been a kind of unexplored space. And the only people here are the parent pioneers. Everyone else has just come up with an economic reason or scientific reason to say, too small to matter, costs us too much to do this compared to a bigger disease, why bother? That those are usually the litany of complaints for big pharma as to why they don't want to be in this space.
I mean, it's honestly mind-blowing. Like, I think a lot of people listening to this are like, wait a minute, I'm sure, we use the term rare diseases, but there are 10,000 different diseases, and there are how many millions of people that are affected?
1 in 10 people affected. I mean, what people don't even realize is that there are more people living with a rare disease right now than living with cancer, heart disease, and Alzheimer's combined. Mm-hmm. So each one of those, people with the rare disease is going to have some different rare disease. But the fact is, you put them in a room, 1 in 10 people are gonna have one. And I've already tried this out, because it's another topic, but I've been doing some rare disease stand-up, and working the crowds, you realize that you ask people, do you know someone with a rare disease? And a lot of people will say yes. And then even if they don't know right away, if you actually prompt them and they go and they explore their network, they come back and say, oh yeah, my cousin's friend, or my best friend's sister, or my so-and-so. And it's like, yeah, well, no surprise. The statistics told us this. It's just that no one either cares about rare because it's been marketed poorly, or just that word rare makes you turn off. Because unless it's like a rare earth metal, you say the word rare and people are like, yeah, I'm not interested.
Yeah, it doesn't affect anyone. And it turns out it affects 1 in 10 of us, right? And so,
and it goes deeper than that. It goes deeper than that because most of us are silent carriers of a rare genetic disease. This is how I realize you get people's attention, because it's like, I don't have rare disease. I don't know anyone with rare disease. Oh yeah, tough guy? Well, there might be a genetic ticking time bomb inside of you. And that's something that gets people's attention.
I agree. I mean, for those of us that have sequenced our genomes, whether it's 23andMe or some of these other services, you find out that you were actually a carrier for cystic fibrosis or for thalassemia. And so you are literally, one baby away from having to jump into the rare disease space. So I think, this is an area that's like super exciting. I want to move us over to DeSci briefly. I know this is where the crypto meets the world and crypto meets science. And for those that are on X, we've seen this, like people are super excited about DeSci, decentralized science, and they're also saying this is a massive scam and whatever else. By the way, I just wanted to say this is never financial advice. This is edutainment. We're talking about really understanding. We will never give you financial advice. This is a crypto thing. For those of you that are in the crypto world, always do your own research. Really important. But, what is decentralized science? What is DeSci, right? Because I think it has many meanings. And, I think many of us are still learning a lot of what this actually means. So what does it mean to you, Ethan?
Yeah, I mean, at the core, it's just really integrating blockchain technology into the way you build a biotech business from kind of day one. What's the attraction of blockchain here? Well, it solves a couple of problems. Blockchain as sort of a funding mechanism, that's maybe most familiar to people. And, the biggest pain point we want to solve for rare disease families is taking that financial burden of funding research off of their plate. So they don't have to deplete their savings. They don't have to beg their friends and families for money. They don't have to take on the risk of the earliest, riskiest research. So the power of fundraising on blockchains is going to solve a major pain point for families. And then the other thing the other second biggest pain point is the ability to control the destiny of the research. So many families and foundations get rugged time and time again. They fund the research, they do it through this hybrid system of an academic lab here and this academic lab there, and then maybe a biotech at some point comes in. Then you got all these, fingers in the pie, everyone's got a piece. And then when the commercial sponsor says at the end of the day, yeah, I'm sorry, I'm not interested, boom, that program's killed. The IP has to kind of be clawed back. Sometimes there is no clawback. Often the patient groups that funded the first work, put in the first dollars at risk, have no say in the matter once the program's been abandoned. So imagine if you could have smart contracts governing the flow of data of patient samples, so you could track where things are going, how it contributes. And then you could also bake in these anti-shelving and clawback provisions so that if people don't play nice with the IP, it doesn't all just go get lost in legal limbo, which I've seen time and time again happen. So I think blockchain, just through fundraising and through smart contracts, and particularly IP-NFTs and the ability to control and fractionalize sort of ownership in IP, those are just two features that you could maybe try to cobble together in the TradFi world. The thing is, I tried kind of to do that through Pearlstein as a PBC, as a public benefit corporation. And there's just limitations to how you can stretch the system. And there's also, that ends up just selecting for kind of the richest, most sophisticated families to play. And so it's not a level playing field. So I think the real reason for me to kind of, why now, why DAO? It's really that, blockchain solves a lot of problems that rare disease communities acutely feel.
Yeah. And I think, what a lot of people don't realize is how hard it is to make research dollars work for the real research. There are a bunch of incredible researchers out there that really are trying to do their best, but academic science moves slowly. Patients usually have a need there and then. And not only that, what we've seen with the latest, very controversial, by the way, NIH guidelines around limiting the indirect cost to 15%, the institutional cost. A lot of people didn't know that when a university gets a grant or a professor gets a grant to do research in a rare disease area, the university might take between 30 to 70% of that grant for indirect costs for running the university. It's shocking to a lot of people. And so it's like, wait, we should be more efficient than this. And so I think for me, I'm very excited about using the liquidity layer of crypto, of using the smart contracts to organize leaner and meaner studies. For me, what really blew my mind, honestly, was Pump.Science, and to see decentralized CRO essentially testing in worms for longevity, then testing in flies, and now obviously moving into mouse models. It was so lean and mean. And I know you've run your lab in a lean and mean model, and I think we can do so much more with so much less money in many ways. And I think the era of DeSci is only just arriving now. We're only now just going to see what's possible with leaner, meaner funding structures, and that we honestly need, and that people can take ownership of too. It's the idea of the community owning some of the revenue and the profits of a breakthrough drug or a supplement or new science is like really, really exciting. And so I think hopefully we're getting back to the anarchic era of science. We need more weirdos. We need more people trying strange things to accelerate science. We're just not moving fast enough for most people. And most people, when they get a diagnosis of something, they feel very hopeless. They feel like they can't do anything. And I think this is a way of saying, no, actually, you're not. You have the power to really change the future for everyone, including yourself and the people that you love. And DeSci, we really originated in Ethereum, and then we've seen an evolution from Ethereum, and now we've actually started to see it spread on Solana, with pump.science for longevity. We've seen Big Pharma AI, which is really focused on creating open source, decentralized AI tools to analyze science. I know that recently you've been involved with the Mira token, which actually was phenomenal. I'm very excited. And maybe if you talk a little bit about Mira, and then we'll get into Curetopia, because I know a lot of people are excited to see the first BioDAO that's actually going to be Solana-native, launching on Solana soon. And so why don't we talk, because I think Mira was a really interesting evolution of like, hey, there's this token that actually is helping someone's daughter. So you want to share that story?
Yeah, so I've been incubating Curetopia now it was incubated for 6 months last year, starting at DeSci Berlin. That's kind of when the real inspiration for this came together. And then obviously with crypto markets and other factors, the timing of really launching Curetopia wasn't quite clear, but then we knew it was going to be at the end of 24. And then very serendipitously on Christmas Day, it was 9 o'clock on the West Coast. And so everybody was sort of chill and things were quiet. My kids were asleep. So of course I fed my Twitter addiction. And then just first thing I noticed was a tweet from this guy, Siki Chen, who's like, some rando donated 50% of a meme coin to my daughter because he saw my GoFundMe to raise research for my daughter's rare cancer.
And his aim was like 100,000, right? He was hoping to raise 100,000.
He was hoping to raise 100K on GoFundMe and 30-day campaign or whatever. And then this Christmas gift arrives, and then a space was opened up, and then everyone's just watching this token massively, take off like one of Elon's rockets. It was just amazing to see the degens come out and just express their sympathy. And then of course we also saw the other side of the animal spirits later on the dump. But in the pump, it was Christmas, it was cookies and Santa, it was just a hallmark moment, right? And then at first I was like, my first reaction was, crap, how come no one thought about a meme coin that was going to fund rare disease research, right? And people had just been talking about Fartcoin earlier that month of like, memes are just backed by vibes and nothing. And I didn't think at the time, well, what about if it funded research, man? Like then it would be, and that just, enough that the last dots didn't get connected. And even Siki was like, wasn't necessarily thinking this. And then boom, this degen just makes it happen. So for me, it was just completely orthogonal validation that there needed to be some kind of a crypto tie-in into rare diseases. And so Curetopia was going to be something that I was already about to launch behind the scenes. And then boom, this thing explodes and just completely proves out the thesis that you could create a meme coin around funding something real. And then of course it happened on Solana, which also got me interested more in that chain. But at the end of the day, I'm multi-chain, polychain. I don't know how you say it, but
you're multi-chain. Yeah. Mm-hmm.
But for now,
and I was just going to say, and Mira's story and Ziki's story, he was able to raise over $1 million for his.
So at the end of the day, within that very short time, they were able to secure $1 million. So they got way past their goal in way faster time. And then also 10,000 plus kind of now holders of this coin in the beginning, I think, who were probably for the first time holding a real meme coin or something that was going to, aspire to be something then more than just a fart or a Doge or whatever the hell else people obviously would associate with a meme coin. So so seeing just the evidence that independently the universe was converging on this was cool validation. And then of course,
Ethan, it's just worth saying one really important thing for the scientists that are listening, like, how is this even possible? It is just, crypto just moves at a speed which we just don't move in science, or even TradFi, traditional finance, just doesn't move that quickly. And so ideas can very quickly, within hours, can go from ideas to fully funded projects, concepts, meme coins.
Less time than it takes to run a PCR overnight or a Western. You could fund the whole lab that has the Western blot machine.
The right idea with the right community can create, entirely new projects that transform the world as we see it, right? I think Balaji talks a lot about creating network states that are focused on doing things. And so, for those scientists especially who are like, what is this? Definitely read Balaji's Network State book. It's actually available free, but you can also buy it too, where he really talks about the idea of going from an idea, a token, a community, a network state, right? And so I think for those of us, it's like there's something truly magical about the speed, the interlacing of an idea, capital, culture, all of this together to make magical things happen, and also make horrible things and meme coins and silly things happen too, right? It does that too, right?
Totally.
So yeah. And so go ahead, Ethan. Sorry.
No,
I just wanted to add a little context because I know some scientists listen to this and they're like, how is this possible? This sounds like a scam, so it's like, well, sometimes things are scams and sometimes they're not, and the line between the two is hard to see sometimes.
Yeah, you got to use your brain.
It's a frontier. It's a frontier. It's like the Wild West. It's a frontier, and so all the things happen at the same time.
So Mira Coin just independently validates the idea of tying crypto financing a community with like a real purpose, a real noble purpose. And then since then, I've been in touch with Siki multiple times. We've met up. We're both local here. And I don't want to kind of preempt ourselves here, but we're discussing ways where Mira DAO and Curetopia are going to be able to collaborate officially. So we'll get all those details out there. Very excited to iron out that over the next few days and let everybody know. But yeah, I definitely want to work with Siki, and there's other rare dads and moms like him, but they still are kind of the exception. And so Curetopia is really there to level the playing field. So you don't have to be a tech entrepreneur or have a massive following in order to help your kid. That obviously gives you a massive head start, but Curetopia is there to also level the playing field.
Yeah. Honestly, a passionate mother or father can move mountains, right? We've seen this over and over again.
I've seen it a million times. Yeah.
Achieve what honestly seems impossible from the beginning. I know you and I have both talked to mothers and fathers who basically said, I'm going to do everything I can for our kids.
And let's also not forget people who are adults with their own rare disease who are fighting on behalf of themselves. Yeah, I tend to kind of have a bias or just experience more with the pediatric cases, but like there are tons of adults living with rare diseases that are in some ways even have a tougher time because kids always get sympathy. But now imagine, especially if your disease is invisible because it's pain or Ehlers-Danlos syndrome or something that you present as normal and no one would know, and so you get even less sympathy. Let's not forget, obviously, those champions too.
I would say they're very powerful, right? Because they're adults, they're activated, they can really go after things. I know there's some people in our communities that actually do have rare diseases and are inspired by decentralized science. I was just going to say one of my favorite mothers is actually Martine Rothblatt, who started United Therapeutics to cure her daughter's pulmonary hypertension and found a drug, repurposed it from GlaxoSmithKline. Her daughter is alive and thriving, and Martine knows that her daughter eventually will need a lung transplant, and is now not only made a profitable biotech, one of the most profitable biotechs on the planet, but is now moving research to regrow organs, including lungs. I mean, these stories are incredible what people can achieve. Yeah. So Ethan, tell us about Curetopia. So we're getting ready. You're getting ready to launch. So tell us about Curetopia.
Yeah, so Curetopia is currently set up just like the other DAOs as a Swiss nonprofit of Rhine. So Curetopia's vision is to eradicate rare genetic diseases for all humankind. And so it means totally disease agnostic, all 10,000 plus diseases in play. It means geo-agnostic, means doesn't matter if you're in a rich country or a poor country necessarily. And we're modality agnostic. I don't care if it's CRISPR or small molecule or cell therapy or some Frankenstein of all of them. So that's a huge ambitious scope. But what we're going to start out with, as I said before, solving kind of two pain points for rare disease communities, especially small ones: access to liquidity to get the research flywheel going, and then smart contracts that define protections for patient communities and allowing them governance rights, but also allowing them to contribute other things to the research project in exchange for utility token rewards. That's Curetopia's goal, is to take the DAO model and apply it in the rare disease space. And in terms of our actual science focus is drug repurposing for all. So drug repurposing won't cure most rare diseases for most people, but it's going to be a great start and an amazing foundation that allows you to learn things like which endpoints respond to treatment, which endpoints are the most robust, what's your response rate. So hopefully with drug repurposing for all, we can at least give everyone with any rare disease that first pass until OpenAI or whoever's going to give us super intelligence. And as Sam's now saying everywhere, it's going to be curing diseases left and right. Well, if that promise is true, then we won't need to do a lot of stuff. AI will just tell us that you need to try this, this, and that, but that oracle's not here anytime soon, or, in a few years from now, that's great. But right now, what are we going to do for people suffering now? And so that's why we've got plans to be able to do drug repurposing in a way that can scale across all diseases using testing platforms that are truly disease agnostic. And you can check out the Curetopia vision paper and our roadmap that gets into more details of how we plan to do that.
By the way, what an amazing vision. Imagine one day there's 10,000 different tokens to cure 10,000 different diseases. To give everyone that's listening an idea of scale, every day on Pumped Up Fun and various other token creation tools, we get somewhere between 10 to 30,000 new tokens every single day. Most of those are memes. Most of them are going to zero fast. But the reality of it is, instantly, like one day of tokens might actually be able to attack and in many cases treat and cure existing diseases. And it doesn't just treat today, people that are suffering today, but it's everyone going forward. And the vision of that is just so vast, so incredible to me. And I think the science is really important, right? And then on the other side, for the crypto side, it's like, okay, I get it. It's great science, great project. Sounds like a nonprofit. It's not a nonprofit. The aim is to bring the crypto layer in and to find ways of driving value, right? As we know today, the biopharma industry, you corrected me when I said this. I said the top 50 are $1 trillion market cap. It's actually not. It's the top 10 big pharma are $1 trillion market cap. That's just a tiny slice of the opportunity. Developing real therapeutics, real supplements, real therapies can be transformative and very profitable too, especially if you run really lean. So do you want to kind of share some of your thoughts on that?
Yeah, I mean, we do envision go-to-market strategies like what VitaDAO is doing, like what Brian Johnson's doing with Blueprint, where we can take advantage of the fact that we find a lot of nutraceuticals as our top clinical candidates for repurposing, because we stack the deck, because we look at metabolic diseases. And that's, I think, has some real promise for health span and longevity kind of applications. So I see using go-to-market DTC strategies that other BioDAOs are already putting into play. I envision a way where once Curetopia has a portfolio of IP-NFTs, we could enter into licensing agreements, but probably really only do that with, for example, a PBC or another entity that is going to respect the same patient rights that we have. And so patient staking and patient ownership that we have to bake in the cake. And then I could imagine also Curetopia holding as investments mission-aligned rare disease platform companies that have proven technologies that can take out lots of diseases at once. I think those would actually make for great investments by Curetopia and be a great asset for the treasury. So I think definitely have plans for go-to-market. This is not a charity at all. This is about finding sustainable revenue-generating models to keep the treasury going. And then also, I think there's essentially, you're getting options on these expansion opportunities, right? Which one of these supplement stacks might actually be something better than Blueprint or better than what Brian Johnson's coming up with? And then, which ones of these nutraceuticals could be the starting point for an AI designer drug optimization campaign? Why don't we make a better vitamin C? Why don't we make a better aspirin? Or why don't we peel off the good parts of this old drug and embolden that and then get rid of this part we don't like? There's so many ways where everything we find can end up being a stepping stone and a springboard, but also we really embrace DTC. Perlara has been a DTC biotech. And so that's kind of in my DNA of whatever we're doing, it's got to have a DTC component. And that's why Perlara now it's been a self-sustaining cash flow positive business for the last 3 years. So I definitely learned those lessons and see the power of going DTC.
Yeah, and I think it's powerful. For those thinking of investing in the DeSci space, it's important to really think long-term. These are not quick flips. It's you don't invest in terms of hours, think in terms of months and years. I think that's the right way to really think through.
That said, for biotech, the speed that biotech usually goes at, we go even faster with rare.
Yeah.
And so I get that people have like maybe some degens need some reality check and be like, hey, biotech takes longer to cook. However, we got this express, line, and we can get meals made, boom, boom, boom. And like, I think that hopefully they'll resonate with that.
I remember you were telling me with the yeast, you could get results as quickly as a couple of weeks. Right?
So we did this already. So as part of Curetopia's launch, we got a grant from Bio, 100K, to do an initial project to get some initial data, right? And none of the other BioDAOs were able to actually convert that into results. We did. Just last week, we got results from the screen that we set up, and we started that over Christmas time. So basically, it took around 6 weeks from start to finish. Once we got the yeast in the lab to getting the results off the computer, about 6 weeks. And I think we can go maybe a little faster, sometimes a little slower, but that's the timeline. So it's like pumped out science.
Just so people have an idea, a couple of weeks. So you basically took yeast, you got something that actually helped those yeast that had that mutation that could help those people, right?
Yes.
Some kind of supplement.
And then within a few more, and as I told you with NMN, within a few months of that, I can show you videos before and after and prove it with a validated clinical instrument that there is an effect, right? And do it in multiple cases, not just that one. We've moved from N of 1 to what I call 1 to N, recognizing that every intervention starts with 1, and maybe it stops there, but maybe it goes all the way to N being however many there are. And so that's our framework, is like showing proof of concept in the clinic with multiple patients, and they're all doing this in their own self-organized clinical trial. The parents are taking the outcome measures with their phone, right? They're sending the data to each other in a WhatsApp channel, and like no clinician clinicians are involved, of course, we're not totally rogue, but like you don't have to ask for permission. This is permissionless drug discovery.
Yeah. And I think we're entering into a new era, right? Where hopefully things will move faster. The FDA will be lighter, right? But it's permissionless. Like we don't have to wait for the FDA, which is honestly, a lot of people don't know this, but some divisions of the FDA never approve even one drug a year. There's some divisions within the FDA don't even approve one drug a year. They're one of the reasons why we move so slowly. People attack big pharma often, understandably, they're not efficient and they waste a lot of money, but the FDA, the government, is a huge part of the problem too. And so having this permissionless innovation in our own healthcare is really it's incredible. And for those people that really want to look into this, who are like maybe new to the biotech space, there are a couple of examples of companies like Biogen, Ultragenics, BioMarin. I don't know if there's any others that come to mind that they can look up, and I'm trying to understand, what is rare disease? What's the possibility with these things? How do they make money? How do they, and these are very profitable companies that make a huge difference in a lot of people's lives.
They do. And they still are ultimately going after the fat part of the long tail, right? The part of that's like the common rare diseases. It sounds like an oxymoron, but there's like common rare, medium rare, ultra rare. Some people claim there's nano rare. I'm like, what are we going to go all the way down to femto?
Okay, nano rare.
Like maybe this is taking the metaphor a little too much, but yeah, you get the point. It's a long tail. So yeah, even companies have figured out how to make money, but kind of on that juicier part of the tail. Curetopia is really about the 95% of diseases that are not part of that, but could be made sustainable and attractive if we were lean, really lean, and if we took approaches that bundled diseases together.
I mean, the potential, again, on the small end, the biopharma innovation that's possible with decentralized science is $1 trillion plus market, right? Like and it's a market that's only just been born. I think at the moment today, all the DeSci tokens together are under $1 billion, right? Paul from BioDAO, he regularly says when I'm like, oh, it'll at least 10x. He was like, 10x is tiny. He's like 100 to 1,000x. Yeah. And so, Ethan, I wanted to talk a little bit more, just before we move on, actually. I wanted to just say, okay, so when is Curetopia coming? Tell us a little bit about Curetopia, and I want to talk about the future. So when is Curetopia coming? What should people be looking out for? Reminder, this is crypto. It's going to go bananas. Do your own research. Never financial advice.
And no dating advice either. So
yeah, no dating. Even worse.
So Curetopia is born. It exists. Go to curetopia.xyz. You can see there's a vision paper. Hopefully, I've shared that. It should be linked up on the site as well. We've got a Telegram group. We've got an X account. So the entity has been kind of live since around just before Christmas and public. It was incorporated at the end of November. So Curetopia is out there. And then, and there's a Telegram, as I said, the X. There's ways to engage with us. We've already been building community. I've been hosting spaces every week. So we exist. And now what's exciting is the auction. We're hoping that we can launch the auction at the end of the week. Stay tuned to our Telegram and X channels to actually get the precise date. But hopefully the auditor and the testnet, everything will be finished up tomorrow.
I also want to buy some Curetopia myself. And so let's talk a little bit about the future of DeSci, right? There are crypto people that think DeSci is a scam and all this other stuff. Let's talk about like the opportunity for us, like thinking really high level. Where can we go, right? In a world where stocks can be tokenized, where capital is liquid, where we have BlackRock creating their own funds on chain. Where do you see all this going? This decentralized science, where is this all going?
Where I hope DeSci goes is that it is going to become more inclusive. I know that's not a popular word to say anymore, but I mean that just in that sense of like, it can't just be all crypto autist testosterone energy. That's not going to scale. And startups in general have that problem. Tech startups, I know obviously have that problem. YC has that issue still. And I'm not saying we should be in a 50-50 male-female world per se, but every organization I've led and been a part of has naturally ended up there. So what I hope is that the future of DeSci is more estrogen and more balance. I do believe that just the more diverse an organization, it's just like monoculture versus polyculture. Do you want a forest with one plant or do you want an ecosystem?
We all want a diverse selection of minds, right? However you describe them in science, it's always important to have diverse minds because these diverse minds lead to fascinating insights that you just wouldn't get otherwise. And so that's every flavor of every mind has something to provide in science in particular. And so but really thinking about this, right? Like thinking about like a highly liquid layer for biotech, we still have a problem with scientists struggling to get access to financing. We have people honestly disenfranchised with the accessibility of science. There's so much dissatisfaction from both scientists and the general public that once we have this AI, the data can't be behind a paywall because then you can't even when you have this amazing AI from
Well, that's the thing. Like deep research. Yeah. How does that even work? I'm pretty sure they're only scraping abstracts because unless OpenAI has bought Elsevier and Wiley and other subscriptions, how are they getting through the paywall unless they're all doing Sci-Hub? Unless they're all elite, which, but like the point is, imagine if one of those AI companies just buys, someone tweeted this, just buy subscriptions so that you can actually get behind the paywalls, train on that, and then you have everything. Maybe that's when the oracle comes. But
it's all broken. It's all broken. Like if you truly wanted to do decentralized open science today, it is totally and utterly broken in every single way you can imagine. Closed data sources. The tools are super closed and expensive. If you want the best tools,
interoperability. Yeah.
No interoperability. You want the best tools. You want to use AI. You want to model proteins and molecules and their interaction. Turns out all this stuff is either ancient and open source or really expensive. You have to buy a license, and it doesn't work with each other. And so, like the entire infrastructure for open decentralized science has to be rebuilt. I think that's also the opportunity for us where public research that's being funded is not available to the public. Blows my mind. It's published in Nature and Science, which scientists get a lot of kudos, they get promotions, they get grants because of it, but then then the people can't read about their disease or they can't read about the latest breakthroughs. And so I think we need a fundamental shift. Brian, the founder of Coinbase, has done incredible stuff with RSC, the research hub. Plus, which is not a token, is open science. And so we need a lot more open science. We need accessibility to the data layer. There are hundreds of companies and tokens and infrastructure layers that need to be built for us to accelerate science for all of us, for all of humanity. And honestly, I think we're going to see this is global. One of the things that I love about crypto, it is truly global. If you go to the Pump.Science Telegram, it's in every language you can imagine, right? It's Chinese, Turkish, Spanish, you French, you English, you name it, and the entire community's there. And we're seeing other chains getting excited about it too. I think Say also just launched a $65 million fund. I know Boost, Adam Draper is investing in DeSci companies. We're just at the beginning of when all of this is happening. I know Adam Dalgelli at True Ventures is also investing in a lot of the BioDAOs as well. And so, this is the beginning. Honestly, it's been pretty hard to raise money in the biotech space, conventional biotech. We're seeing this kind of opening up of new possibilities in the crypto space. So
yeah, I'm super excited. And just maybe one final thought is like, I do want that future where you imagine there's a meme coin, there's a token for every community. But I think realistically, we're not going to get there overnight. And if every single rare disease group just launched a meme coin tomorrow, we know what would happen, right? We've been seeing it. So hopefully your Curetopia can end up as like the starter coin that anyone can get access to. And then when your community matures, great, go butt off like a yeast cell and make your own coin.
And the idea of being able to use really unconventional ways of funding and financing biotech is just so exciting. And I agree with you. Not everyone should start today. The token, you're building a base layer. With Curetopia, you're building a base. All right, Ethan. Well, look, thank you so much. This was our first DeSci Pilled podcast. We're really just so excited to have you here. Can't wait to see what you build with Curetopia, and looking forward to talking again, hopefully sometime soon.
All right, next time you got to add those DJ sounds, just like how.
Oh yeah, we need some nice DJ sounds. Thank you for listening to this episode of DeSci Pilled. We have a lineup of new episodes ready to drop, so tune in each week as we explore the endless frontier of science and crypto. This podcast is a bioprotocol production. Onwards to the frontier.